Anthony Fauci right back here on our Pix 11 morning news show. I spoke to him yesterday afternoon. He made time out of his busy schedule, asking him all the questions that you at home want answered. Dr. Fauci, thank you for coming back to the Pix 11 morning news. We appreciate you. And although it looks like the end is near, Doctor, I'd argue that we need to hear from you now than ever. So thank you for being here.
Well, it's good to be here. Well, one thing is for sure, we're going in the right direction, and we're doing it pretty dramatically. If you look at the number of daily cases that are calculated on a 7-day average, I believe the last time we spoke, they were somewhere around 60 or 50,000 per day, went down to 40 to 30. Now it's less than 20. Mm-hmm. That's really good news. The one thing I would like to, I am very encouraged by it, so I don't want to get anybody to misinterpret that. But we always want to make sure people realize that we don't want to declare victory prematurely. We've got to continue to get as many people vaccinated as we possibly can.
Yeah.
And as we open up, we got to be careful that if you are in a region or a city or a state or somewhere where there's still a lot of infections and you are not vaccinated, you should be wearing a mask. The best way to get rid of that mask is to get vaccinated.
Dr. Fauci, you're actually talking about the numbers right now, so I'm going to jump to that because if you look specifically in the areas of New York and New Jersey, right, we do have some good news. New York and New Jersey are reporting their lowest cases since the start of the pandemic. New York, in fact, reported a day of 0 deaths this week. So how close, then, are we to declaring that term, which we always hear, herd immunity?
Yeah, again, as I mentioned to you the last time that we had an interview, we don't know what that threshold number is. The concept of herd immunity is you take the number of people that are vaccinated plus the number of people who've been infected, recovered, and have durable immunity, at least for the time being. Mm-hmm. You put that together and you will reach a certain level. We know what it is for measles. It's 90+% right. For measles. We don't know exactly what it is. So rather than trying to contort ourselves to figure out what that number is, why don't we just get as many people vaccinated as we possibly can? Okay. And when we hit that, we'll know what it is.
So whatever that magic number may be, right? Say it's 70%, which we've heard about, right? At what point then can we declare an end to the pandemic? Is that something you foresee in 2021?
Well, you used an interesting word there. End of the pandemic. This is a global pandemic. And not every state and not every city has as low an infection rate, as low a death rate. Now, I heard you didn't have any deaths for the first time in a long time in New York City. It isn't uniform throughout the country. So one of the problems is we live in a large country that's quite interconnected. So I don't think that we can say, okay, the pandemic is over in New York, but it's going on in another state.
Right.
It's over when it's over uniformly. And that's the thing that we've got to strive for. And why I keep talking about, for us, it's a country epidemic. For the world, it's a global pandemic.
Right.
We've got to crush this throughout the country and throughout the world.
Agreed.
Then we could feel good about not being in danger.
All of this, Dr. Fauci, is reliant, of course, on the current vaccines continuing to be effective. And we know Pfizer and Moderna have already begun trials for what's being called boosters. A big question from our audience was, how certain are you that we will need one, right? Crystal ball here. And how soon would we?
Well, the answer to the second question is easy. I don't know. We don't know how long is going to be the durability of the protection. We are doing studies now to try and determine either from the laboratory data, which are called a correlative immunity, when it gets below a certain level, it might be predictive that you're going to start getting into trouble with breakthroughs, or even the clinical observation of more breakthrough infections than you would normally be seeing.
Let me just interject for a second, because you just said breakthrough, and we saw that take place in the New York Yankees, right? 9 players with the breakthrough. What does that mean? That the vaccine is less effective then?
No. Again, you've got to know what the denominator is. So if you have millions and millions of people infected, and you have, vaccinated, I'm sorry, if you have millions and millions of people vaccinated and you have a 94 to 95% effective vaccine, there's going to be a certain percentage of people who were vaccinated that are going to have infection. So if you look at the breakthroughs don't indicate anything more than the efficacy that we got from the clinical trial. So right now, things look good, that we're not seeing an inordinate amount of breakthroughs. When we do, or if we do is a better word,
good,
then we'll be thinking about the boosters. So that's the answer to your second question, when. I hope it's years, but it might be sooner. And that's the only thing we need to do is admit, be open and honest enough. We don't know how long that's going to be. We'll be monitoring it and following it. And when it looks like we need the booster, we'll give it.
And that's why we keep having you back. That's why we keep having you back, to keep having these conversations, right? And help us clear up the confusion around these bad boys, right? These masks. I'm fully vaccinated myself. So do I have to worry, Dr. Fauci, about being indoors in, say, a store or a restaurant without a mask where other people are not vaccinated?
Right. You personally, as an individual, do not need to worry. You can feel safe outdoors and indoors. The complexity of it is when you're dealing in a society in which not everyone is vaccinated, we haven't reached herd immunity yet, and there's a possibility, if not a likelihood, that in a given establishment, that there will be infected people who are not vaccinated, who could infect other non-vaccinated people. So the establishment might say, in order to come in here, you've got to wear a mask, because right now I can't tell who's vaccinated and who's not vaccinated. But you as an individual, even though it might be required when you get on a plane or when you go into an establishment that's requiring a mask, as an individual, you can feel safe that even if you went in there without a mask, you would be safe. But sometimes you've got to go with what the institution is telling you you have to do.
Almost out of time here, Dr. Fauci, and I want to get in a few more topics. Focus on the kiddos, because the last time you were here, you laid out a timeline for kids. You gave that green light to hug grandma. Everybody loved that. So are we on track to have all kids as young as 2 eligible for the vaccines at the start of 2022, or do you see that maybe happening sooner?
No, it could be towards the end of 2021. I mean, the studies are ongoing right now, so we may get enough data before the end of the year. But I don't think it's going to be next month. I mean, that's impossible because the studies are going on. What we're going to see is that adolescents, 12 to 15, as you know, are already getting vaccinated. Those will be vaccinated by the time they get to go to the fall term, which is really good for schools. The younger kids, I think it's going to be towards the end of 2021. I don't think it's going to be much later than the very early part of 2022. You know what I'm hoping? That we get the studies done efficiently and we get an answer before the end of this year.
All right, Dr. Fauci, those were the hot button issues from our viewers. I do want to get to the news of the day, and that is, I'm sure you know about this, the thousands of emails that were made public, right? From the start of the pandemic to the height of it, including the origins of this virus. This morning you said it was misconstrued. Can you elaborate and how you feel about those emails even being out there?
No. I mean, I'm a public servant, so people have access. I mean, it obviously feels like an intrusion, but it is what it is. And when you're a public service, people have access to what you do. I think that the Washington Post and the CNN and BuzzFeed, I think they did a really good job of saying, if you look at it, you can get a really good feel of what I've been doing, is trying to take very seriously in a polite way interaction with any of a number of individuals. The answer to misconstrue is that one of the problems is that when you get thousands of emails and you have an email, if somebody has an agenda and they want to make a gotcha point, it's extremely easy to pull a phrase out of an email and just give those words without the context of the email. Or take an email on one day which says something that is a little bit uncertain, and then 5 to 10 days later, there's another email that completely explains it. You show one email, but you don't show the other email. And that's what's going on out there in some people who want to do the gotcha.
Understood. I appreciate you acknowledging that. I always end on a light note with you every time you come here. Last time you said you enjoyed Coney Island hot dogs. Coney Island hot dog eating contest, sir, back in person for the very first time because of the pandemic. Will you be there, and how many hot dogs have you ever eaten?
Unfortunately, I'm not going to be able to be there at the Coney Island hot dog eating contest, but I'm good for 2, and on a good night, maybe 3.
Nothing on Joey Chestnut, who could do 72. Dr. Fauci, until next time, thank you very much for your being here and your perspective.
Good to be with you. Look forward to next time.